Hi.
Who are you, ma'am?
I'm Dr. Hines, and I have a mobile practice in the Louisville, Kentucky area. And today we're going to be taking a look at Brady.
Brady is such a good boy, even though he couldn't get into the van because he didn't like the way his ramp was working.
Mm-hmm. Yeah.
Most times you just jump up the stairs, but he's at that point right now, and Dr. Hines gets it completely, where he needs a little bit more assistance. And so what I wanted to do today was ask Dr. Hines of Derby City Vet. This is mobile. It is so cool. It's this great big, 26 feet?
That's it.
26-foot truck that looks like my dad's motorhome. And you have the opportunity to go anywhere you want to and do anything you want to. So I'm going to step right over here around the corner. Brady can see me, but I want you to just conduct what you would consider to be a normal exam.
Okay.
So
Certainly.
I'm right here, Brady Boo.
Okay.
I'm right here.
Certainly.
You let Dr. Hines do whatever it is that she's going to do and be a good girl, be a good boy, whatever you are.
Absolutely.
So Brady is an 11-year-old lab Dane, just for the benefit of those who are having the opportunity to see him for the first time.
Okay.
And he's a very good boy. He also has, David Pate already said great vet.
Oh, that's nice.
Good job, David. Thank you so much. So he has a little fear because he's getting into that time of his life where not everything is certain. And you're working with him beautifully. He's not the least bit afraid with you.
No, not at all. So
I like that.
Currently, is he on any medication?
He is. He takes thyroid medicine.
Okay.
He takes one in the morning and half at night.
Okay.
And he is also taking some, what do you call that stuff? Novox for his little hips.
Certainly.
And he's taking fish oil, which I've heard is really good for him.
Great for the joints.
Yes. And he is taking, what's another one that he's taking? Oh, he just finished something else that you gave him at the pool when he collapsed on the side of the pool. What was that?
That was methocarbamol.
Methocarbamol.
Right, because Brady had a history of intervertebral disc disease and a little bit of discomfort along the spine, and that day he was down.
He was down.
We didn't expect that, and
terrifying.
Yeah.
And I was so glad you were there because it could have just been. It could have been so much worse.
Yeah, he was definitely in distress, that's for sure. I mean, he was having a great time.
He was.
Which is awesome.
Yeah.
And then, that back kicked in a little bit.
So just a little follow-up on that so people know what we're talking about. When he was actually standing by the pool, he suddenly had been swimming for a while. He suddenly just kind of fell down.
Yep, in the back end, right here.
It was so scary, and he couldn't lift his little butt up off the road. And so here we are, standing at this pool at the Northeast Y, and all these other dogs are running around, and he's, just being silly and having fun. And here we are, not able to lift this 90-pound dog up. So thank God Dr. Hines was there. She came over, she lifted him up. She was just so sweet, and he was very good. And now she's examining his eyes. And tell me what you're seeing in there.
Yeah, so first and foremost, prior, while we were talking there, I'd palpated, the structures of the head, the musculature, looking for some normal responses to things that I'm doing.
Yes.
And checking that stuff out, making sure we don't have any sunken or painful muscles of the head. And then I had looked at the globe itself, and then, of course, I got out the ophthalmoscope. He does have a little lump on his eyelid.
Yeah, I don't know what that is. That's so strange.
Yeah, kind of suggestive of probably, if you were to take it off, papilloma type common. We also do see some other structures of the eyelid gland that with age, they will start to grow.
11 years old.
Right, something called a meibomian gland. That's a normal gland, but with age they can get a little bit large and inflamed. But this one, the way it looks, it's got little, almost like finger-like projections.
Ew.
That fits, it's not so bad, but
it sounds awful.
Fits more with a papilloma.
Meibomium sounds like something from outer space. Oh my gosh.
Yeah. So other things with the ocular exam that I'm taking a look at there, with the ophthalmoscope, yes, from the naked eye or grossly without my tools, I can tell that when I look into and gaze into his beautiful eyes,
he does.
I can see a little gray, or what some people would say blue, haze, and that's cataracts. I mean, that's also what else we see with an aging pet.
Yes.
Aging is not a disease.
That's true.
Yeah, it isn't. So we just try to manage. And what's important too is just knowing what is it? What is a cataract? How does it affect his vision? And how can you help him in managing that? And is it necessary to pursue surgery? That sort of thing. And go from there. But
well, I think that's one of the things that they do to humans too. Like I was told recently, I have degenerative disc disease in my cervical spine.
Get out of here!
So I'm just freaking out, and I go to the physical therapist this morning because the first thing the doctor's PA said to me is, "Well, you're going to need surgery. You have no discs between C5 and C6." So I'm a little bit freaking out, and I go to the therapist this morning, and he looks at me and he goes, "Everybody has degenerative disc disease.
Yes.
You do not have to worry, and you're not going to have surgery. We are going to get you fixed up."
Physical therapy all the way.
Relief.
Yeah, rehab. Good stuff, even in dogs. I love it.
So when you are examining a dog of his size, obviously you can't put him on a table with as great an ease as you can with most
they don't
other
like
people.
it much. Makes them nervous.
It does, and as I said, getting up this ramp that I carry was also challenging for him because he's not used to getting into this particular vehicle. He knows his own car, and that's about it.
Yeah.
But I think one of the things that is beautiful about this particular vehicle is that it is easy to access. You can treat a fairly significant sized dog in here.
Yeah.
He's a big boy, and I imagine that if you were to treat little dogs, you could put them up here on this counter that I'm standing behind.
Absolutely,
right now.
Absolutely.
What are you doing to my ears, Dr. Hines?
I'm just looking.
Feel them. I don't like people looking in my ears.
I know. Come here.
All three of my dogs, Dr. Hines, he's the best behaved.
No, he's an angel.
Yeah, he's a very good boy. So ear-wise, what do we have to look at for dogs who are getting aged?
A little bit of wax.
Selective hearing.
Definitely.
Just like people's, spouses, do we say selective hearing for them too?
Yes, I do. I say selective hearing all the time in my older pets. Because I am mobile, I do see a lot of older pets. I see a lot of pets who haven't been to the vet in a long time, whether it is mobility issues, behavior issues, or other physical limitations. So the aging pet holds a very big place in my heart. That's for sure.
Yes.
Certainly. But yes, hearing. People will complain about hearing loss often. That's a tough one to tell. It can be as far as diagnosing and that sort of thing. But usually the complaints I'll get is, "Hey doc, I don't think my dog can hear anymore. I walk right up on them when they're sleeping, and they still don't move." But the point is that they can feel your vibrations, right, on the flooring.
Yes. Or they sometimes have another guide dog.
Yeah, they do. A younger one who says, "Oh, Ruff,"
We can take his gentle leader off, and he'll be a little bit less.
Yeah, there we go.
That's better, because now I'm free.
So certainly, with just my general otic exam, I'm examining the pinnae or the flap, or and I'm looking just on the external ear canal, and then certainly with my tools I'm going to go ahead and start looking in there, and I'm looking for wax. I'm looking for reaction, right? This little guy with his ears, and I do say little guy to just about everybody. See, he's itchy, and I did see some wax in there. No real infection, but see, I got him itching.
So let's see what you're looking at when you're looking in an ear. I'll be real interested.
Yeah.
What is it that I'm going to have done to me now? What is it? It's an otoscope.
It is. And
An
we're getting all the way down there.
otoscope.
See anything?
Oh my goodness, I see a hole in my head.
Mm-hmm.
So you can see wax? Is that what you're telling me?
Certainly. Yeah.
Is it a ton?
No, I'd
Is it
say
more than normal? Because I clean
just
their
a little.
ears.
This is, I'd say, out of typically mild, moderate, severe.
Yeah.
I'm going to go mild.
Okay.
Because one, he is reactive. He's itchy. This,
Loves that. He
This time of year in this area, we certainly do see allergies playing a role, and makes their ears itchy. Usually you just have to up your ear game a little bit, maybe start using a little bit of flush, or if there is an infection, you'll do ear ointment or prescription medication.
Okay.
We don't need that here. The ear flush is probably plenty, something that's, prescription strength to help flush out the wax until the season passes, until it gets really cold and all the allergies chill out.
Okay,
Good boy.
so tell me about the body exam that you were doing just before
Certainly.
we started. I
Yeah.
want to know, because he's had mast cell tumors.
Okay, sure.
So we have to be aware of that, and I map his bumps.
Perfect. Love it. Love it. Okay.
I have a body outline that looks like somebody was murdered, the chalk outline on the sidewalk, and I document every lump that comes up on this boy.
Yes, that's a good boy. I know, sweetie. That's great. So yes, that is extremely important and very relevant history for any pet of what they've had in the past. I like to follow what a lot of the pathologists in our field say. If it's bigger than size of a pea and it's been there longer than a month, it's time to get at the minimum an aspirate, and even maybe a biopsy or even removal. Okay,
wow. So longer than a month, larger than a pea.
You got it.
Okay.
Yeah, I like to get a needle and get in there and send it off to the pathologist and see what we got.
Wow.
It may be nothing. It may be fat. It may be nothing. Something that's benign. But it might also be something that's starting to turn a little bit.
That was scary.
I really like preventive medicine and being proactive.
Yes.
That's important to me.
Yeah.
Yeah.
Well, I tell you what, the day that Brady's vet, Dr. Green from East Louisville Animal
Certainly,
Hospital,
yeah.
told us that he had mast cell tumor cancer,
Oh.
we just freaked out.
Oh, it's awful.
I mean, we almost lost our minds at the thought of what was going to happen. And I remember the vet tech, Frank Knuckles, saying to the doctor, "Doc, you don't understand. Nothing can happen to this dog."
Oh,
And
who's
he of
special?
course greeted him when he was 6 weeks old. So Frank
Sweet.
had a long relationship
Yeah.
with my dogs.
Certainly.
But the mast cell tumors apparently have a different kind of feel
They
than
can.
a lipoma. So
Yeah.
can you talk to us
That's
a little
right.
bit about
so,
that?
Oh, I know. Mast cell tumors are certainly, also in the field called the great imitator. Okay.
Oh.
They can look like anything. They can feel like anything. But yeah, there are certainly a few telltale signs: itchy, red area. Quick growth on anything. I don't even, quick, meaning, I just found that, but here, let's keep looking at it, and what is this? If the dog is scratching, chewing, doesn't like you touching it. We're certainly more worried about mast cells that do pop up in the back end.
Oh, really?
Yeah, those have a little bit worse of a cancer rate.
See, so
back
he
in
had
this
one
area.
right back
Yeah,
here.
so those are usually the more aggressive ones.
The ones you got to watch.
Yeah.
Whoops,
but
dropped your
all of
mic.
them.
Pick your little mic up. Here, I'll put it back on you. Can you get it? Run it up underneath your...
Yeah.
There we go. So anyway, back end. We got to watch for the back end ones.
Uh-huh.
All right. Uh-oh, windscreen
Oops.
off. Technical difficulties. Hang on. You hang on to this for 1 second. Show Brady. I'll fix your mic.
Right?
You can keep talking. I'll hear you.
I know. Hey, bud. There you go. There's
I'll
that
keep
handsome
talking.
guy.
Let me just fill the time, okay?
So see,
Dr.
you can
Hines?
see that little bit of gray haze there. That's the cataracts I'm talking about.
Baby boy. Okay, so we got to watch for mast cell tumors on the back end of the body, and he had another one on this right front under his little armpit.
Yeah, and you
that
know
was a
what?
big one.
Yeah, and certainly
Man.
too, what is extremely important from the surgical aspect of that is those wide margins. Some people say, "Oh, it's just tiny, take it off," but you got to understand the science behind it. You want to get that stuff before it's seeding, as we
Yes.
say, and so it's going to look like this huge area. And don't freak out. The surgeon is doing what they needed to do. So.
So his incisions were gruesome.
Right.
Let me just tell you,
Yeah.
I thought he was going to be scarred for life, but I didn't know that underneath an arm you have to sew it a certain way.
Yeah, certainly.
So that you can get
Yeah.
the end result that you want, which
Yeah.
is a perfectly clean you can't even tell that it was an
that's
incision.
right.
Incision.
I mean, I would probably, if you hadn't told me, I don't know that I would have found it.
Yeah.
Honestly.
Yeah, that's pretty amazing.
Nice work, huh? Nice work.
So, yes. So, when we have mast cell tumor cancer, apparently, if you have what he did, which was a low mitotic rate or low replication rate, he didn't have to have chemo.
Good.
Others do.
Yes, others do. And chemo can be, you know, even anything from, in some cases, and you know, for every budget too, and everything from prednisone, as well as even Benadryl and famotidine, which are common human drugs that many of you know all about. But it's really about managing and trying to keep that stuff under control.
So I am going to watch you do the body exam because we did that a little bit before we got started. But I want everybody to be able to see what you do. Looks like your daughter's finished with her veterinary,
right?
With her dental treatment.
Yeah, right. Hold on, just a second.
Okay, let her on in.
Okay.
Stay right here, Bray.
Hey guys,
stay right here.
I got it.
Awesome.
Oh my goodness! He says, "Look, it's a little child coming in.
And it sticks.
Come on in.
And this one sticks.
Yeah.
Come on in. Hi. How are you?
I got this surprise.
How are you?
Hi. Are you the dentist?
Yeah, that's
We're doing a Facebook live cast. Say hi to everyone.
Hi, guys.
Get out of here.
No, you're fine.
It's here. I was like, I want to see it here. This is so
Certainly.
neat.
Tell us your name.
My name is Dan.
Dan what?
Oh, Carol. Are you?
Yes, this is a Facebook live cast.
This is my dentist.
Hi, dentist.
I'm sorry.
Dr. Dan.
I'm sorry.
I love it. And
You're doing great.
Awesome.
where did your other person go?
This
You
is
hiding?
Hi, Brenda.
His name is Dr. Carol.
Oh, I love it. What did you get? Did you get a new tooth or what?
No,
She had her
just nice
cleaning
and
today.
clean.
Cleaning
Everything
today.
checked out fine.
Awesome.
Brady would like to have his
Doing
teeth
fine.
cleaned too.
She gets a little emotional about that.
She does,
Yeah.
right?
Yeah.
I told her she forgot for a minute that this is a fun thing.
Yes,
Fun
it is.
thing.
I have a painful tooth too. I might have to come in there after we're done here and have you check my tooth out.
Awesome.
I'm sorry.
Thank you.
No,
No,
you're
don't be.
fine.
I'm
You're
glad you
totally
came in.
fine.
Oh, good.
Mama,
You're on
this
Facebook
one
Live.
sticks. This one sticks.
Let me have that.
I'll be
real
in
quick.
quick.
Bye, Doc. Now we just have to find that little foam.
Here it is.
There we go.
Yes, honey.
She's so cute. Come here, Brady. You're not
Brady,
going
honey,
anywhere.
You can't leave. He's like,
Wait a minute. We're getting
Yes,
all.
This one sticks.
hooked
I
up here.
remember I lost the other one.
I do,
No.
honey.
But
Okay.
I love the fact that you can travel with your child. That is
I
so
do.
nice.
Well, it's multitasking. I mean,
It is, and here we go. We all multitask. So let me say hi while you get hooked up and you get her into her little compartment. Goodbye. See ya. There's the driver's compartment. I love it. So Deb Humphrey is watching, Kim Good, Debbie Horan,
Awesome.
Rita O'Hearn Smith of Louisville Lost and Found Pets Network,
Oh,
which
nice.
Kentuckiana Lost and Found Pets Network. Let's make sure that's straight. Judith Youngblood, great animal lover and fosterer. Mari Eisenman is watching us from Oregon. She says,
Ooh, hey.
"Hi Tara, how's Brady? He's behaving so well." Well, this is the doctor who helped him, Mari. And Bart Conley is watching us, Marlon Gaines, Cassie Simon from Washington, D.C.
That's awesome.
Selena Olagus. Melanie Hope Armstrong says, does she come to Lanesville, Indiana?
No.
That's too far, isn't it?
Yeah, but I you can always find me and give me a call or email. And I do know a couple of vets that do cover that area.
Good.
In southern Indiana also. Here,
Cool.
honey.
So Kathy's watching, Pam's watching, and John Marshall, great realtor. Tanita Gaines, fabulous singer.
Awesome.
William McCall.
Absolutely.
We appreciate all of you guys being
Aw.
here with us. So now we're going to move forward
Yeah,
with
sure.
the physical exam.
Alrighty. So one thing
You
that I'm
can
going
turn
to do.
the air conditioning on if you
It's
want
fine
to.
with the
'Cause
sound.
Are you and I both getting hot?
Yeah,
Yeah, it's getting a little hot. Brady's probably getting
Oh, no.
hot too.
You may.
It's the traveling vet and mom truck.
You got it. So certainly on any pet and every pet, I'm gonna palpate all the lymph nodes.
Yes,
okay.
that's a
So
good idea.
there's a whole bunch of them, and certainly there's a list that we all know that you should be able to feel, and there's a list that you should not. Okay.
Oh, wow,
Yeah.
that's an interesting
so
thought.
that's just stuff, and my physical exams, and every vet is different. I'm usually kind of a nose to tail physical exam. One, because it allows me to kind of just go ahead and get real personal real quickly.
Okay, do it. That's
and,
good.
And so that's just my natural way. But certainly, yeah, I'll start lymph nodes up here. Push.
So they're in the same place ours are.
Many of them, yeah.
Right underneath
Many of
our
them,
neck.
certainly. Also, while I'm up here palpating the lymph nodes, I'm going to feel in that area of the thyroid gland. Okay, I'm going to feel right through there.
Okay. Does it feel normal to you?
Oh, yeah, certainly. I know,
When I
sweetie.
take thyroid medicine, Dr. Hines, what does that mean?
Well,
Yeah, you like his voice, don't you? If he takes thyroid medicine, then does it mean he doesn't produce enough?
that's right. In the dog, okay. In the cat, it's flipped, right? in the
right.
dog, it's hypo most of the time.
Okay.
Hypothyroid,
Okay.
an underactive thyroid gland. In the cat, on the flip side, it's hyper thyroidism,
I'll be
and the
darned.
signs are very different and almost opposite, if you will.
Wow, that's cool.
But yeah. So usually, okay. So we move under here. Perfect.
So what's under there?
So
Talk us through it.
more certainly. So more lymph nodes, right? So up here, always feel these at the point of the shoulder.
Okay.
Also, at the same time, I'm palpating to see if there's any discomfort or pain.
He's not indicating any.
No, he could care less. That's a good boy. And then certainly
That's
these.
because Mommy's taking me to Baskin Robbins.
Ooh, hey, that sounds
promised
awesome.
me.
Yeah, you know that I'm going to take you to bed.
Whoa.
Oh, that's very loud, isn't it? That's very loud. Brady, hey, cool it. Cool it. I'm going to put this camera up here so I can pay a little more attention to my boy.
Okay, I know, Brady. I know. No. Go up there. Go up there for
Okay,
now.
here
In
we
a
go.
minute.
Here we go.
Alrighty,
Right here.
so lymph
Dr.
nodes
Hines
here.
is going to examine you while I
Certainly.
stand right here. And
Lymph nodes
pretend that-
under the axilla or the armpit.
Okay.
Axilla.
Good.
Okay, and then I'm going to move on back and just keep feeling all the same time for the normal stuff. And there is a
Hey,
small little hair.
keep talking.
Yeah.
Keep talking. Don't talk.
Okay, leave.
We want Dr. Hines to talk, but not Brady.
Oh well, Brady says I want to be heard, huh? I
So-
want to be heard.
So, when you get to that back, you
Uh-huh.
felt his spine a little while ago.
Yeah, I did.
And you were concerned just because that's where he,
Yeah,
had some
so
weakness.
over Saturday, certainly it was back through here. And many times, the dog. Most patients will tell you. Everybody says, "Oh, you're a vet. You talk to animals." Well, they really do talk to me sometimes.
Sure.
And it's really, in their physical response to what I'm doing to them, and that's my feedback. That's what makes my brain work. Okay.
how they respond.
You got it.
So as you feel his spine,
Yep.
it's telling you.
Well, he's not now, and certainly at this point, endorphins are kicking in, right? We've been
Yeah.
here a little bit.
Yeah.
And he's like barking and saying, I'm kind of ready to go, Mom. But, yeah. Okay,
I
thanks.
don't want to do Waggin Wednesday anymore. I'm tired of it, Mama.
So, yes, he kind of trembled a little bit in two separate areas, but like I said, he's not doing it now. And also, I was there. I knew the area,
Yes.
which was further back here, thoracolumbar, very common area in a large breed dog, or even extra large, because the Great Dane in him is an extra large breed dog. No, back up there. Okay, all righty. Okay, so furthermore, I'm going to keep palpating down. Don't feel anything weird today.
That's always good.
Some
to know.
dogs, yes, you're doing a physical exam and you hit them at the right spot and they kind of go down. Okay, and that's important.
So here's a question about something that happened to us a long time ago, and that is his tail just fell
Yep.
and would not rise, and it was
Limp
after a
tail.
bit, a
Yep.
little dip in the river
Yep.
in the cold.
Yeah.
What's that?
I-
What's
I-
that all about?
I don't remember, I don't remember from school what that's called.
Drop tail or
right?
something.
It is.
Yeah,
it's
it's a drop
just got a
tail.
very basic name, but
Very scary.
yeah,
It
it
was
does.
like, oh my God,
Yeah,
what's
but
wrong
I've
with
seen
his
it.
tail?
I've seen it, and it's always been dogs that have been swimming, active, not just lying around. I mean, active dogs.
This was
And-
like January the 1st.
Yeah,
We
yeah.
were down by the river on New
Yeah.
Year's Day, and he was
And
just...
and it's painful too.
Yeah.
It's painful back here with the musculature, and then but usually we'll respond to non-steroidals.
anti-inflammatory.
You got it,
Just
and
like we
rest
said, right?
and exercise restriction.
Brady,
I know, Brady. I know.
You gotta stop barking.
So
Oh,
furthermore,
no,
I'm moving
no,
on
no.
back to the rest of the lymph nodes back here, and they feel normal.
That's good.
Okay,
That's
so
very
then
good.
at this point, this is when I'm gonna probably, in a big dog, stand up, and start palpating, pressing on the belly. See what we think.
Pressing on his
and go
belly.
under.
All right, good.
Okay, and then I'm gonna, take a visual of the prepuce in the male. It's
Yes.
important. Yes. You want to look for any kind of discharge or inflammation or swelling. And then I'm gonna go ahead and kind of palpate pulses in the back.
Okay.
Okay, which is the femoral
Where are
pulse.
his pulses?
So the femoral. Okay, so the femoral pulse right here in between the thigh.
Okay.
Yeah.
That's what they're doing.
Hey,
Yeah.
that's enough. That's enough. That's enough.
I know.
We have to say hi to a few more people. Give him
Awesome.
a chance to chill a little bit.
Okay.
Of course, Melissa Swan would be watching on the day that
awesome.
Brady's being the worst. Hi, Tracy Sprouse. Oh my God. Don Pendleton. He's like, let me out
Outta
of here. You can't go yet. You can't. Do you have any water?
Yeah.
Let's get him a drink of water.
here.
I think he just might be
That might be it.
it.
All right.
I'm just thinking that he might, because he's panting.
Uh-huh.
He's showing signs of. Oh, now he's looking at the ground.
Oh, he's like,
because
what's
your-
that sound? That's
your
the
motor
sink.
is running.
That's
Isn't
the
that
sink,
funny?
bud.
Yeah, I think that's what I need. I'm so thirsty.
Aw.
I'm so thirsty.
You okay?
Good boy.
Yeah.
Drink your
Mhm.
water. Good boy.
There you go,
Drink
bud.
some water. Good boy.
I mean, I got treats too, but I don't know if you're allowed. Okay, so that helps him.
Sometimes
Yes.
we
The
have to-
elevated.
Yeah.
Yes, I love that, right? I
Well,
bet he
he's-
has that at home.
He's got
Yep.
a stool.
Good.
And Wyatt has a stool.
Perfect.
That just raises
Here,
that
I'm fine to do
level
that.
up a little
Yeah.
tiny bit more, so
Certainly.
that they have the opportunity
Yeah.
to not bend their
That's
throats.
right,
And
absolutely.
you can see he has to spread his paws
Yeah, mhm.
in the front in order
To
to,
help.
get to the ground.
Aw, that's a good boy.
So now,
Yeah, there we go.
That's so much better.
Your mom knows you so
I
well.
was so thirsty, Mama. I didn't know what I was going to do.
so Dr. Hines,
Yes.
Brady has a song.
He does.
He does, and he likes to hear his song. So
Okay.
while you do a paw check, because I
Okay.
would like to know
Yep.
exactly what it is that we are to look for in toenails, and what
Okay.
the best and most effective way is to clip toenails.
Okay. Certainly.
Tell me what it is that we look for to make sure that our dogs have safe and healthy paws.
Okay, I like that. So certainly that is another part of my physical exam. When I am going to look at the feet, I'm going to look at in between the toes because you
No,
can.
you're not.
Well,
That's wrong.
furthermore, I'm looking for growths. You can find growths or lumps there. You can find signs of yeast, inflammation, or chewing.
Where am I going now? I'm gonna go over here. I need more water. That's the problem.
So
No.
yeast in the ears, that's been a big problem for a lot of dogs
Yeah.
in the hot
And
summer
even
months.
in between the toe pads too.
Oh, really?
Yeah, they'll chew.
Oh my God, I didn't
They're
think
itchy.
about that.
You're done?
I'll let you look at my feet now. Maybe.
Maybe.
Maybe I'll drink some more water first.
He is a big siphon.
Mm-hmm.
He siphons water, and
Yeah.
when he comes in from being outside,
Yeah.
it's just he and
Buckets.
Wyatt are just like drinking
Buckets.
of
Yeah.
water. It's not even funny.
Sure.
Okay, so the paw thing.
Yeah, certainly.
Stay
So-
right there for me.
So yeah, so some people will say, "Oh, I know that I need to trim my dog's nails because I can hear them on the floor."
Oh, boy.
Yeah. So then you
That's
say,
a
"Okay,
problem.
yeah, it's a little bit long." Not all, not always, but usually when we are going to trim them or even Dremel them, where
Yes.
you're filing them back, which helps the quick or the blood supply.
Yeah, that quicking, boy, that's painful.
Oh, it's terrible. So what you want to do is, yes, to have regular nail trims or dremeling to help that quick recede.
Yes.
Yeah.
Okay, gotcha.
So certainly, yeah, I would be looking at that, looking at all of them, making sure none of them are swollen, painful, bleeding up here in the toe area. Some dogs don't really like their feet being touched.
He's okay.
I mean,
with it.
he's fine, but there are
Gracie's
plenty
not.
that don't.
Yeah, I didn't bring Gracie because of just that. She does not like to have her toenails clipped.
Right, I'm certainly going to be looking for any missing toenails. I mean, that's a huge red
That's
flag.
bad.
Yes, those can be bad.
Now, I tell you what, when we were out at the Northeast Dog Swim and
Uh-huh.
when we were at the Jewish Community Dog Swim, we had a vet tech on site at the
yeah.
Jewish Community Center. There were more dogs with torn pads,
Yes.
torn off nails,
Yeah.
because they were running around on the deck.
Right.
So one of the ways that I know that a lot of people find that their dogs get injured is if they're out on a tennis court
Oh yeah.
and their dogs are running around, or if they're on a place like a pathway that has slots in it, or things that go across a body of water, which is a little ramp or a bridge. They can get their little toenails caught in those so quickly.
yeah, certainly. Yeah.
So quickly.
Certainly.
Okay, so let's talk just a little bit, if you wouldn't mind, about overall dog health going into winter. We've dealt with all the stuff in the summer, and people go, oh, thank heavens, we can stop giving them flea and tick medication now.
Bad idea.
Yeah, I think
Okay,
so
I mean,
too.
unless you're in like Canada, right? Certainly, yeah. In fact, just today on my Facebook page for my business, I had put on there, don't forget your flea products in the fall.
There you
Okay,
go.
many people think, oh, I'm done. Not so much. Okay, fleas live year round in this region.
And
okay,
ticks
first
too,
of all,
right?
Ticks, they can. As the seasons start to change, you start to see fewer and fewer ticks. Currently, I mean, it's been probably a month since I've seen a live tick on a dog or cat. So usually I am okay with my patients being off of their tick preventions. However, I do highly recommend year-round flea prevention.
Okay, so if you're like us, though, I think there might be an exception to the rule for us.
Sure.
We are out in the woods
Oh yeah, okay.
all the time.
Yes, so those
we
dogs.
hike, we walk. So if you're just your normal everyday dog who walks around the neighborhood, not such a big deal.
Right.
But boy, I tell you what, if you are out
Yes,
in the hike,
that's it.
hiking,
Yes, certainly
have to
for
be careful.
hiking.
Yeah.
Certainly.
I have an idea. Where's your treat?
Um,
TREAT, Brady.
is that what it is?
Where's my treat? Yeah, where's my treat? I'm gonna have to do some tricks for my treat.
Oh,
Haha, trick or treat.
there you
Ha,
go.
ha, ha, ha.
That's what it is.
Yeah, he wants a treat.
But yes, certainly I do recommend that. And mosquitoes are the same thing. Mosquitoes spread heartworm disease to dogs and cats.
Did not know that.
Absolutely, they're a vector. They bring it.
Oh my God!
Yeah.
I had no idea
Okay,
that's
3.
how they got it.
I'm gonna get you. Watch out.
Yeah, it is. So I do recommend your heartworm prevention and your flea prevention year round in this region.
Sit. Sit.
Oh.
Sit.
I
Aw.
don't want to.
And he's getting to the point where he may not be able to sit.
Yes, and that
very
is true
effectively.
too
Can
in
you
the
get
older
down?
in the older
Can
pet.
you lie down? There, he does a down dog.
Oh, there we
That's
go.
a good adaptive measure, Brady. You stay right there. Down, down. Watch
That's a
this,
good boy.
Dr. Hines.
Ooh, let's see.
if we can
I love
see it.
tricks.
Let's see if we can see it. Watch this. Here we go.
Tricks for
Wait.
a treat. Okay. Oh, I bet I know.
Wait.
I bet I know.
Wait. Wait. That's the best boy ever. Wait. Wait.
Take it.
Good boy.
He and Wyatt will lie there looking at that treat for 5 minutes.
Such
without
patience
flinching.
and discipline.
They are. They're very good. Okay, shh, shh, shh. Now, look, you do this all the time when you
Oh.
go to another place that you are not supposed to bark in.
Uh-oh.
Down,
Good.
all the
boy.
way down.
Good boy.
Good boy. Stay. Wait.
Okay. Let's see.
All right. What else do we have to cover when it comes to things that happen in the wintertime? Because I know a lot of
Okay.
people who worry a great deal about frozen paws.
Yes, they do. There are some things, in one thing in particular, with an older pet, traction. Okay, so you don't want them slipping. So think, yes, rain and snow or sleet or something like that. You're going to have a wet mess in and out of the doors,
Yes.
right? In and out, and they got to go outside to potty, and then they come back in and they're slipping and sliding. So footing is a big deal. Certainly in the areas where they have to put ice down, salt, for the ice. Yes, some of those can burn the pads tremendously. I do know I've seen some very nice salves and ointments for that on the market to help them out for that. But it burns. It's almost like a a paw pad burn type of thing. It's a salt burn.
Is there anything truly as a pet safe rice melt? Seriously, is there anything?
I don't know the answer to that.
Because I've always heard that no matter if it says it on the package or not,
right? Yeah,
it still causes
right.
damage.
Because when you think of what it's made of, so ingestion of any type is going to be a problem.
Well, the University of Louisville president, Nancy Bendaputi, is watching us. And Dr. Bendaputi, I apologize for my son's bad behavior. He just is not having an optimal day, but it's not because of what a wonderful place this is. Debbie Gober, thank you. You'd like to talk to your nephew and see if you can get him to settle down here. But anyway, what we're doing today is we're talking to Dr. Bridget Hines, and she is a fabulous mobile vet with Derby City Vet. This is a 26-foot beautiful mobile veterinary unit. And let me just kind of scan around if you don't mind. We've got all these places for wonderful supplies, and I just love all the cabinetry. I mean, this would be something my mom would love to have been in. It looks just like her motorhome. And it's all a supply. There's everything. You've got a generator in here, I'm assuming.
Certainly,
if you can't plug in somewhere.
Right. And some of the equipment requires that kind of power.
And obviously, water is supplied too. More drugs. We've got a TV screen for seeing X-rays, which is cool.
Yep, there's
Back
that.
here, there looks like it's a little. Shh. You're being so loud today. Little surgical unit. Now, what kind of surgeries would we be doing in a mobile veterinary unit? I would think that there would be a tremendous amount of time consumed.
Yeah, there can be, but it kind of depends on the practice. You know, some practices that are all mobile, they'll only do surgeries to certain days of the week. Some will do high volume spay neuter clinics. I've seen these formatted like that too. All kinds of things.
Well, and then, I like what you've got.
It is a treatment area.
Yeah,
too.
you really do. You have a very nice, clean. This is the cleanliness factor for me.
Oh, okay.
You know,
Awesome.
if it's not clean, I don't want to go in it.
Yeah.
I mean, that's like a hotel room, a restaurant, a veterinary clinic, whatever. So, I mean, I'm just amazed. And all these air systems, my God. It's got to be air cleaners as well as just air blowers, because it feels like Brady.
He wants treats.
Yeah,
He said, I want another treat.
So the reason that we're doing this is to show you guys that there's more than one way to get something accomplished, and I won't use the regular phrase that they use behind the words, there's more than one way.
Right.
That's not a veterinarian's favorite term.
No.
Hey, Brenda Davison, nice to see you. If you keep jerking your hands away because you say to him gentle.
Oh, gentle.
Tell him I said
Okay,
gentle.
your mom said gentle.
Gentle. Watch this. Hey, crazy dog, come here. Look, sit down.
Oh,
Gentle. Gentle.
so good for mom.
Good boy.
Okay, gotcha.
Wait.
Yeah,
Gentle.
Oh, okay.
There we go.
With the nibbling.
Yeah, he gets so excited.
I
He
know.
can't
I don't.
I know.
got
Yeah, I
nothing.
get so excited too.
So when you're in a mobile veterinary unit, you have the ability to go just about anywhere you want to.
Yes.
What's the range that
gosh.
Derby City Vet will actually go?
Sure.
And I know you've got it all listed out on your website.
Yeah,
too.
I try to, but I certainly serve Louisville and the all the surrounding counties in Kentucky. No, I'm not licensed in Indiana.
Oh, you can't go. That's why you said you couldn't go to
right, I'm not
Lanesville.
licensed there.
Okay.
But I know people who are, so
Yes, so
we
you
try
can
to
give a
fit,
recommendation.
certainly, yeah, that helps.
You know what he does that's so funny? He does that. Except if he's trying to get off the table, food off the table, he'll lick and lick and lick to the side, but he can't get the food
Right.
off. So right there, you're giving him the advantage of getting it
Oh
off
my
the
goodness!
edge. He's so bad.
How many treats have you had?
I don't know, but I'm a big dog. I can have as many as I want to.
Okay, so here's what we're going to do.
Okay.
We are going to talk a little bit about the fact that he's got cataracts.
Okay.
He's got a little spinal issue. He's got a little. Do you think he has hip dysplasia yet? If at all.
I'd have to see films. I don't know.
Oh, you have to look
Right?
at the films.
Yeah.
Yeah, I guess so. And so he's got a little bit of selective hearing because he's not listening to me say,
Right,
stop
right.
barking, Brady. He has a voracious appetite, but
But?
you said that his body is in really good
Oh,
condition.
certainly, yeah. So another major important thing about a physical exam on any pet is body condition scoring, where we're hold on, where we're taking into account the age, breed, reproductive status.
I don't have one of those.
Right.
I can't reproduce.
Well, thank God for that.
Weight and how they look and feel. So that's another thing I'm doing when I'm doing a physical exam. I'm physically, eyes first and then hands, and I'm looking to see, do we have that nice hourglass out at the rib cage, in at the waist, back out to the hips. Okay. Secondly, then I'm going to palpate for the ribs. I want to feel them, but it's okay if I've got to work just a hair. The standards are body condition scores are usually out of 9, 5 being ideal, where you've got the nice tuck at the waist. You don't have to work too hard to get to the ribs. But we do a range from 1 to 9. 1 being emaciated, extremely underweight, to
That's what we hear
9.
about from Aerofund cases.
Yes,
One
certainly.
on a scale of 9.
Yes, 1 of 9, certainly. And then 9 being obviously obese.
I'm not that.
No, and I would give him body condition score 5, which is ideal.
Perfect.
Yeah,
Oh my gosh.
taking everything into account, but he looks great.
I always have been an overachiever, Dr. Hines.
that's important about is with an aging pet is, yes, those hips and knees
Yeah.
and backs, right? If they're heavy and they're carrying a lot of weight, then it's going to just get worse. It's going to be, and it's going to be hard to manage.
Yeah, we don't want it to get to that
yes,
point.
I know. Some people probably think I'm like a broken record, but it's important to me
Absolutely.
to tell them, yes, here's what I think and why.
So this has been a fabulous, extraordinary veterinary exam. I'm sure that he will tell you next time that he does not want to come back to the vet because he's not bad about going to the vet,
No.
but he does this sometimes where he just gets insane.
Yeah, right.
And
Well,
he's
done.
excited and he's
done.
finished and he's
Yeah.
ready to go home.
Yeah.
So what we're going to do
Okay.
is send all of the people who are interested in mobile veterinary practices your way.
Awesome.
And we appreciate you. What is the
you're
website to get a hold of you?
Certainly, it's derbycityvet.com.
That's easy.
Yep,
Want to give us your telephone number too?
certainly. Area code is 502-758-5558.
Fantastic.
And
Dr.
certainly,
Bridget Hines.
Facebook too.
Oh yeah, Facebook too. And your beautiful daughter. What's her name?
Fiona.
She says, I can't hear you. Brady.
Hush, hush, hush.
Fiona, it was nice to meet you. Can you wave goodbye to everybody? Say bye-bye.
I'm going to say bye-bye to you, and I'm never going to be on a Waggin Wednesday again.
No.
Because this is terrible. I don't like being on camera.
Good boy.
You're a nutty buddy, Brady.
He's awesome.
I need another treat, Dr. Hines.
I know.
Dr. Bridget Hines, thanks so much for being with us today.
You're welcome.
Have
Thank
a
you.
wonderful day.